Hello there, my name is Katie and I'll be helping taking care of you today. Today we're going to be performing the Mohs surgery procedure on you, and it's quite simple, so don't worry. You've been diagnosed with basal cell carcinoma, which means you have a cancerous tumor on your epidermis or just your skin. It's a skin tumor that arises from the basal layer of your skin, which is the outermost layer. It's an abnormal and an uncontrolled growth that comes in many forms. It can look like an open sore, some red patches, bumps, scarring, you name it. It probably looks like it. Though basal cell carcinoma is generally metastasized, it can spread if we don't treat it right away. Therefore, our goal today is to remove the lesion from your skin so it doesn't have any chance of spreading anywhere else. So the Mohs surgery is done by a specially trained surgeon specific for this certain procedure. Also can be specialized in some pathology and reconstruction surgery just in case. It is a surgery that will be done in stages since we have an on-site lab that is done here. So I'll be taking you back into the room and the doctor will be drawing marks around the lesion with some ink. And once that's done, he will inject some anesthesia onto the site, so that way you won't even feel a thing. Once that kicks in, he will be using a scalpel to remove the thinnest layer of visible and cancer tissue. And next, he will be, once that's done, I'm going to bandage you up, and I'll take you into the lobby so we can send that tissue into the lab for some examination. If no more cancer cells are there, you are free to go. Otherwise, if some cancer cells are found, we will have to bring you back into the examination room and repeat this process. With that being said, the surgery can be simple, but sometimes it can last several hours just depending on how many cancerous cells are in the lesion. Also, taking the tissues back and forth to the lab may put a delay on things, but we will get you out of here as soon as we possibly can. Once we're done, we're going to go over some wound care in detail, but just so you know that you have to be very careful and take very good care of your stitches. There's a risk that you may have some scarring from this, just depending on how much we need to remove. And please know the importance of using some sunscreen when you are outside, so that way we do not have to repeat this at all. You don't have to go through this again. Once you're done, though, you will need to come back in about 5 to 7 days to get your stitches removed, but that's not a big deal. So I know I've thrown a lot of information at you just now, but just know the cure rate for this is about over 98%, so you're in great hands. You don't need to worry. So were there any questions about the procedure you had or anything else that we've discussed today? I'd be happy to answer that for you.